because we're running out of time and then we couldn't complete this topic. So, patient privacy needs during procedure and transportation. Why privacy is needed for a patient during shifting? Any answer? Consent, privacy, why it is needed? Why privacy of patient is, discussed in a separate session? Any one answer?
To maintain dignity and the respect for the patient.
Very good. Is it Rehaban?
Yes, ma'am.
Okay. Except him, any other? It is also a patient right, right? Last time we were discussing few patient rights. One of our patient rights is to maintain privacy during, procedure or transportation, to maintain data privacy. All these comes under patient rights. Got it? As a healthcare worker, it is equally important for us to maintain patient rights as well, to respect or to respect our patient rights is one of our responsibility. Yes.
Yes, ma'am.
Maintaining patient privacy is crucial during medical transport procedures and transportation, including ambulance services. That means whenever you're trying to shift the patient from the scene to ambulance, try to cover patient completely, right? Sometimes, for example, patient may be, in bad condition where patient may not have a proper dress, right? Patient will be unconscious. Then it is equally important we have, along with our stretchers, we have our patient blankets or bed sheets, right? While shifting the patient, you are responsible to transport or to shift the patient with the dignity. Okay. And then any procedure you do in ambulance, screening is also very important. If there are many, like if there are 2 to 3 attenders in the ambulance while you're doing some procedure, always make sure that to minimize the patient attenders and provide privacy to the patient during any types of procedures. Okay. Here are some considerations for ensuring patient privacy during medical procedures and ambulance transportation. During medical procedures, communication and consent is very, very important. If patient is conscious, if you're doing any type of procedure to the patient, for example, if you're going for IV cannulation, if you're giving any type of medication, if you're going to administer some like oxygen to the patient because patient is having hypoxia, communicate, take consent, and then only do. If sometimes patients will not be accepting for any types of procedures in ambulance. Patient is having 85 saturation and patient is not willing to go for oxygen administration, or else patient attendants are refusing treatment whatever you are trying to provide. In such case, you need to take consent in our forms what are available. Okay. Do not just leave like that, because consent is very important. That patient refuse treatment. Okay, if something goes worse, patient died because of hypoxia. What happens? Again, it should not come on you, or it should not come on us, right? Because patient is not accepting, we are not able to administer oxygen for the patient. So written consent is very, very important. So do not try to neglect taking consent or obtaining consent from patient. Any doubts still here?
No, ma'am.
No?
No, ma'am.
Okay. Communication. Yes? Okay.
हेलो मैम।
Yes.
मैम मुझे ना आपकी पहली स्लाइड खुली हुई दिख रही है, बस रेड हेल्थ वाली, बस पहली स्लाइड
Okay,
दिख रही है।
my slide is not changing.
1 second.
मैम बस मुझे ही दिख रही है, शायद ये किसी और को नहीं दिख रही होगी, मेरे शायद फोन में
Okay,
कुछ
just a minute. I'll stop my screen again and then start sharing it. Thank you for confirming. No?
It's may visible.
मैम। यस मैम, ठीक है।
And also private setting. Conduct procedures in a designated and private area whenever it is possible. So people here will be having some doubts. we are in ambulance while doing procedures. How can we designate areas for procedures, right? You have a patient couch where it is separately there. If there is a usually in ambulances we will not do any procedures like catheterization, right? Or else any procedures. But in case if it is needed, okay, whenever it is needed, you make sure that patient's privacy is not compromised. If needed, use curtains or screens or barriers to create a private space with a larger environment. Okay? Modest protection. Provide appropriate clothing or drapes to maintain the patient's modesty during the procedure. As I mentioned previously, during transportation or shifting the patient, make sure that patient's clothing is appropriate. If there is no proper clothing, drapes, or else you have bed sheets to cover patients properly, maintain that privacy during transportation. Got it? Expose only the necessary body parts for the procedure and keep the rest covered. Okay? If any procedure, I'm talking about any procedures, for example, patient needs immediate catheterization. It happens in a very in very few cases. Okay, if catheterization is needed then and there, what happens? In that area only you try to expose the minimal body parts whenever you are trying to do the procedure, and then provide appropriate screening to the patient. Usually these procedures will not happen in ambulance, but then in worst case or on priority or patient needs demand catheterization immediately, we are ready for providing those services as well. And in that time, at that time, make sure if someone asks you about patient's privacy, you tell about, we will maintain, we will follow, or we will have a dedicated area for procedures where we will have proper patient's privacy. Okay, we treat patients with dignity and respect. Okay, any procedure we do, we only expose the necessary body parts for the procedure and keep the rest covered. Got it? Clear?
Yes, ma'am.
Yes,
Yes.
ma'am.
Yes, ma'am.
And then minimal personnel. Limit the number of healthcare professionals present in those directly involved procedures. For example, if you have two EMTs in an ambulance, okay, which is not needed, right? One pilot and one EMT, right? Yes or no? Sometimes,
Yes, ma'am.
maybe sometimes along with Rahbar, I am also involved in that case. So if I am there, okay, if one female EMT and one male EMT, if there is extra manpower, try to minimize. Okay, it is not that whenever you're doing procedures to maintain privacy of the patient, we need to minimize the healthcare professionals who are there. That means whatever extra manpower is there, we will try to we will try to clear from that area or sit beside the pilot, whatever it is possible. Okay. Communicate clearly with the patient about who will be present at their roles. Also, patient or attendant should know, right? Who are there? If Anita, introduction is also needed, right? I am EMT here. Okay, during transportation, if any medical services needed or if any emergency happens to the patient, I will be there to take care of patient, and pilot will be there, as a driver. Like a pilot will be shifting us to our location is what you need to make them understand clearly. So everyone knows about ambulances, but advanced ambulances are all ALS vehicles have EMTs, right? But what is the role of an EMT? You are a professionals, right? Your communication matters a lot, right? If you don't talk to patient, if you look very confused after receiving patient, you're trying to, take all these equipments from here and there. Patients also will be confused. Always make sure you are all confident enough to handle patient's emergency. How many of you are confident? Tell me. Like, I'll give you one example. Okay, you have received a patient you got a call from home saying that patient suddenly had a fall in home, okay, because of hypoglycemia. Patient became unconscious. You are there at scene. Except Rahban, someone can answer me. You are there at scene. You need to shift the patient immediately to hospital. What you will be doing, Amarjit? Yes, Amarjit. Hello.
Hello.
Amarjit, are you there? Okay, we will remove Amarjit from here. And who are all there here? Saurin?
Yes, ma'am.
Yes. Did you get my question?
Yes, ma'am.
Then what you will do? You got a call from home saying the patient become unconscious because of hypoglycemia. You need to shift the patient immediately to hospital. What you will be doing after receiving patient?
मैम अगर पेशेंट के पास हम लोग जाते हैं तो हमारा जो पायलट होगा और हम होगा तो पहले मैम उधर क्या ट्रीटमेंट का पर्पस बताना है कि पहले तो हम लोग शुगर चेक करते हैं वो सब बताना है कि पहले हम लोग इंट्रोडक्ट करेंगे खुद को कि हाँ ये पायलट है मैं पैरामेडिक हूँ मैं आपका पेशेंट का ख्याल रखूंगा मैं पेशेंट का पहले वाइटल्स चेक करूंगा उसके बाद अगर हाइपोग्लाइसीमिया हुआ है तो उधर अगर कुछ प्रोसीड्यूर करना पड़ेगा जैसे हमारे इधर होता है कि अगर पेशेंट हाइपोग्लाइसीमिया हो जाता है तो या फिर कुछ भी हो जाता है तो पहले हमको शुगर चेक करना होता है बीपी चेक करना होता है वो सब हम चेक करेंगे पेशेंट को एम्बुलेंस के उठाने के बाद उसके बाद अगर हाइपोग्लाइसीमिया सिवियरिटी है जैसे पेशेंट अनकॉन्शियस हो गया है पूरा 60 या फिर 50 शुगर हो गया है पेशेंट का तो फिर हम उधर चैनल करेंगे चैनल मतलब आईवी एक्सेस करेंगे और जब आईवी एक्सेस करेंगे तब पेशेंट को हम पूरा समझाएंगे कि हाँ आपके इधर से मतलब पेशेंट पार्टी को तब पेशेंट अनकॉन्शियस होगा तो इसी की वजह से पेशेंट पार्टी को बोलेंगे हाँ उसको एक चैनल का आईवी कैनुलेशन का जरूरत है जिससे हम उसको डेक्स्ट्रोज दे सकते हैं यानी ग्लूकोज दे सकते हैं क्योंकि पेशेंट अभी अनकॉन्शियस है अगर वो ओरली ग्लूकोज नहीं ले सकता
Yeah. Saurin, what is the glucose? You're talking about glucose water.
डेक्स्ट्रोज मैम डेक्स्ट्रोज मेनली आईवी में होता है तो D25 हम लोग देते हैं अगर हाइपोग्लाइसीमिया हो जाता है अगर पेशेंट कॉन्शियस अगर पेशेंट कॉन्शियस है पेशेंट
So excellent. Whatever Saurin told exactly. Here I just want to talk about our empowerment. Means few treatment needs doctor advice, right? If patient is
मैम इधर मेरा एक क्वेश्चन है अगर मैं एक पेशेंट को शिफ्ट कर रहा था तो उधर मैम एक पेशेंट का हाइपोग्लाइसीमिया 2 दिन के बाद हम लोग हॉस्पिटल पहुंचने वाले थे तो पेशेंट का मतलब जो ड्रीप कुछ भी नहीं चल रहा था पेशेंट का आईवी एक्सेस भी नहीं था तो फिर मैम उधर पेशेंट पार्टी भी नहीं बोल रहा था कि नहीं हमारे पेशेंट को चैनल नहीं करना मतलब आईवी एक्सेस नहीं करना है और पेशेंट भी खुद नहीं चाह रहा था कोई नीडल फिडल उसको प्रीक हो तो उधर मैम क्या कर सकते हैं हम
it is needed, much needed, because before shifting patient to hospital itself, we need to have IV cannulation and give 25% dextrose, right? If patient or patient attendants are not accepting, we need to take a consent of high risk, right? Exactly. No, we are trying to oral glucose. My scenario is patient.
Yes, ma'am. Oral glucose हाँ मैम ये तो कॉमन चीज है अगर पेशेंट कौन सा तो मैं ओरल ग्लूकोज दूंगा पर पेशेंट कुछ खा भी नहीं रहा मतलब ओरल ग्लूकोज के अलावा कुछ मिठाई या फिर कुछ जो होता है अगर पेशेंट थोड़ा सा खा ले तो उसका ग्लूकोज लेवल ऑफ हो जाएगा तो पेशेंट कुछ भी खा नहीं रहा था और कुछ उसका डेक्स्ट्रोज वगैरह कुछ लेने का भी मतलब उसका इरादा नहीं था उसका आईवी चैनल करने का भी
if patient is not accepting any type of procedure which is needed on spot we need to do but patient is not accepting it is you need to obtain consent. Why I'm telling is it is one of our patient right for refusal of treatment is patient's right. If patient you have communicated but still patient is not accepting we have a consent form which is of high risk. You can obtain that consent saying the patient is not accepting for this procedure. You can show the same to hospital staff. Got it? Coming back to our scenario of hypoglycemic patient. We are empowered as a medical professionals or as a paramedic staff. I am empowered to do few procedures without advice of doctors. I'll tell you few scenarios. Okay, not everything. To administer any type of medication or to administer any type of injections, what you will do, you will make a call to doctor, you will write the advice what is given by doctor. Everything goes on call with doctor's prescription only, right? But there are few scenarios. As a paramedic, you are empowered to do few scenarios without taking advice of doctor. Like if patient is not having carotid pulse, patient is unconscious, will you be calling doctor to ask what should I do?
No.
Or you will start doing CPR.
Will do starting CPR.
That is called empowerment, right? If you are there at scene, patient is unconscious, there is no corrected pulse, then immediately you will start doing CPR and rest things you all know as you all are trained BLS and ACLS staff. Okay.
Yeah.
And second thing is if patient okay during transportation you have checked vitals and patient's glucose levels is less than 40. That means patient is at severe hypoglycemic. The patient is severe hypoglycemic. Immediately make sure that patient is having a IV channel and then start administering 25% dextrose. Because here you are going to save the life of patient. This also without advice of any doctor you can do that. Third thing is patient is severe hypoxic. Patient saturation is less than essential.
मैम अभी हम एक कॉल पर गए थे तो वहाँ पे ऐसा हुआ था, वो पेशेंट को वोमिटिंग हुई थी सबसे पहले, रात की कॉल थी नाइट की। तो मैम उनका जब हमने वहाँ पर आरबीएस चेक करा ना, हाउस कॉल पर जब भी जाता हूँ मैं आरबीएस जरूर चेक करता हूँ, बीएलएस कॉल है एसीएलएस। तो मैम उनका 36 आरबीएस आया था। तो डॉक्टर भी थे साथ में, 40 के नोएडा के। तो मैम सर ने बोला फिर से एक बार चेक करो, तो मैम दोबारा से चेक करा तो 108 आरबीएस आया था उनका।
That's what.
पहली बार में गलत दिखाया।
This is also very good question, Anshul. Very good. Sometimes our glucometers, will show wrong values, right? Along with glucometers, you also have to see patient.
और मैम हमने ना मैम तब बोला था सर ने, हमने कैनुलेशन भी कर दिया था तुरंत, और मैंने डेक्सटोज भी तैयार कर दिया था, एकदम रेडी कर दिया था लगाने के लिए।
Got it. Okay. Sometimes what happens, there are errors of glucometers as well. Just now I'm talking to you all, okay, I'm very much conscious. There is no signs of hypoglycemia for me, okay, but you're trying to check my sugars are showing 36. Will you all believe that? I'm conscious, coherent, I don't have any signs of hypoglycemia, but still my GRBS is 36. That means there is some default with mission and you need to check sugars again. But if patient is having signs of symptoms of hypoglycemia like severe sweating, extremities are cold, patient is unconscious, all this along with signs and symptoms, you will also rely on the value of glucometer. Got it? Clear? Are you all there in call?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am. Yes, ma'am. Yes, ma'am.
Cool. And when patient is hypoxic, patient is not having like saturations or not maintaining, and then you are empowered to connect oxygen without any orders, without any prescription of doctors. All these emergency things, what you can do to save patient's life, you are all empowered to do. But without doctor's prescription or orders, you're not supposed to give any injection, or you're not supposed to administer any type of drugs, whether it is simple prescription from or advice from the doctor. Okay, patient is having 104 fever, and then without calling doctor, you know that if you are administering PCM, okay, do not administer PCM without consultant's advice. Okay, why? Sometimes patient might have severe liver disease or cirrhosis of liver. If you're giving paracetamol before shifting the patient, before shifting to hospital itself, patient will land up into death or severe complications. That is what history collection makes a important role. That history collection and pre-assessment, I will take that as a separate session. Okay. Okay. I'm deviating my topic from consent. I'll again come back to consent. Okay. And sensitive equipment placement. Position equipment in a way that minimizes unnecessary exposure and ensure the patient's privacy. Any such things, make sure patient on bed. Do not try to keep defibrillator in between patient legs. Do not try to occupy with equipments, whatever. They do not try to dump all the equipments on patient's couch. Okay, make sure they're all not interrupting patient's treatment. And communication throughout. Maintain ongoing communication. If you are if you're collecting IV fluid, tell them that this is IV fluid, normal saline. If you're adding some injection in that, tell them you're adding this type of injections. If you're giving some antacid, basic antacid, that also you need to clearly communicate and then only administer to patient. Got it? Check on their comfort level and address any concerns promptly. And during ambulance transportation, make sure you have a secure environment. That means ensure the ambulance have curtains or partitions to create a private space for the patient. Use blankets or sheets to cover the patient appropriately. And then modesty and dignity. Dress and cover the patient in a way that preserves their modesty during transportation. Be mindful of exposing the patient unnecessarily when providing care. That means you have to be very conscious that you need to make sure that you are treating a patient. Patient also will have some feelings, right? If you are transporting in a no patient will accept if your if patient dress is not proper, they will be conscious, right? We are they don't know us, and also they will feel discomfort while transportation as well. So it is equally important when you are doing any procedure or when you are handling the patient's privacy plays a important role. Got it? Confidential conversations.
मैम मैसेज पढ़ना मैम एक बार.
What is it?
मैसेज सो मैम पेशेंट का कंसेंट देने में से मना कर दिए करे. कंसेंट देने के लिए मना कर रहा है. They're refusing to give a consent.
What is it? They're refusing for treatment also. They're refusing to give consent also.
Yeah, ma'am. They are refusing to consent form and they are patient. दोनों ही में मैम, अगर दोनों में मना करे तो अटेंडेंट जैसे कि
you should tell that as a EMT technician I am responsible to give proper care and treatment. All these are informed by our doctors that the same thing we are trying to do. If you are not accepting that, there is a consent form, then only we can it plays a evidence that it should have some documentation. Are you guys explaining about the importance of consent as well, or simply you're taking the paper and asking them to sign? Yes, we have the same issues. Few patients will tell that, here it is mentioned that if this treatment is not done, there are chances of death as well. After seeing that, they will not understand. You tell that as a EMT, my responsibility is to provide care as advised by physician, right? If you are not accepting if patient is having hypoglycemia, because of hypoglycemia, if I'm not treating this patient on time, patient may land up into coma, right? Which may lead to unnecessary complications. If you don't want this treatment, please sign here. This is what you need to convey. Okay, our communication plays an important role. If you are not telling anything to patient and asking them to sign on this paper, if you don't want this treatment, they will not sign. You got it, Anshul? You drop the message again here.
मैम मेरे साथ में एक दो बार हुआ है ऐसा कि कोई BLS कॉल जाती है डिस्चार्ज वगैरह तो सिग्नेचर करने से मना कर देते हैं, पर अगर कोई सीवियर कॉल होती है ना जैसे ACLS तो उसमें तो नहीं हुआ अभी तक, बट BLS कॉल में कभी कभी कर देती हैं. और ये मैसेज इनका है मैम बिकेस थोड़ा इनको सब.
That's what I am telling. Whatever, if patient is refusing treatment during transportation, communication is very important. You need to make them explain. Okay, I have informed this condition to doctor. Doctor told this treatment for me to administer this injection or administer this to the patient. If you are not willing, please sign here. It is a protocol of our organization. It's a protocol, right? We're talking about protocol.
Important.
Patient's responsibility. Till now, we are talking about patient rights. Patient is also having responsibilities, right? If they refuse the treatment, they need to give informed consent or they need to sign on informed consent. That comes under patient responsibilities as well, which is clearly mentioned in our handbooks which are there. You can also show them. It should not be an argument, Anshul, okay?
We have to explain to
I am a patient. If I'm a
अगर आप
patient,
यहाँ रिफ्यूज कर रहे हो क्यों कर रहे हो और इससे आपको क्या दिक्कत हो जाएगी फ्यूचर में, तो हम एक्सप्लेन करते हैं पेशेंट को. अगर उसके बाद ये पेशेंट नहीं मान रहा, बोल रहा है कि नहीं मुझे ट्रीटमेंट की जरूरत नहीं है, देन हम उससे कंसल्ट या लेते हैं. दैट्स इट.
okay, Anshul?
Okay, ma'am.
Okay. That's what I'm telling. In our handbook, there are patient rights and responsibility. If patient is having a right to refuse treatment, then they need to sign. It is their responsibility because we have a protocol saying that we should have a documentation, right? If patient is not accepting for treatment because of that patient had death, then who will answer without documentation? Then again, everyone will question you. Why did you not give this treatment on time, right? All these things will happen. To avoid this complication, okay, you have to politely explain. Do not be frustrated. Why are you not signing? This is my rule. My madam told me to take sign. Don't tell all these things. You should explain them clearly. First time, if if they are not willing to sign, second time also you keep your efforts in explaining them. Got it?
Yes.
Okay. Good. And then confidential conversations. Have private discussions away from the patient's hearing range whenever possible. If there is any serious condition for the patient, do not try to discuss in front of attendant saying that, oh, patient is having this thing, we don't know the survival chances. All this type of discussions do not discuss. Also, if patient is having some issues, or you went to a patient pickup where patient attempted suicide, okay, you don't know what are the reasons, possible reasons or what could happen, all those things you do not try to discuss in front of patients or with your colleagues as well. That confidentiality is very much needed. Okay? And while conversation also, patient, you make sure that you communicate everything. Sometimes on call you may need to communicate with doctors as well, right? So do not be very panic saying that, sir, patient is having that, this. No, your communication should be always calm and quiet. Okay. Professional conduct is also very important. Okay, whenever you are communicating, nothing personal with patients. Whatever you communicate, whatever you do, everything should be professionally done. That's what I keep on insisting you in class. You are representing our brand. Whenever you're talking to patient, treat them with respect. Communication should be proper. Okay, all this professional conduct you need to maintain as a Red Health employee. Good. Patient-centered care. Consider the patient's comfort and preferences when arranging them in the ambulance. If patient is trying to tell, you're handling me very harshly, it's painful, okay, please do not do that. Then check for other alternatives, okay? It is not that we are serving patient for free. Sometimes we feel that we came to serve them, so whatever we tell, they should listen. No, this type of attitude we need to we should not maintain that, okay, because patients are our customers, right? We need to treat them and respect them as well. Respond promptly to requests for adjustments or accommodations. If there is some discomfort happening to the patient, if they are asking you, try to check other alternatives, okay, what can be done to make our patient comfortable. That you need to do. And data security is also very important. Ensure any documentation you do that should be properly handed over to other healthcare staff, okay, because documentation importance we have already discussed. It acts as a continuity of care, and documentation is our evidence whatever we have done to the family members as well. Got it? Yes.
Yes, ma'am.
Yes, ma'am.
Thank you all.
Yes, ma'am.
Yeah. Before that, we will open this session for for doubts for 10 minutes. But before that, let me post this poster statement. I have another session at 5 o'clock.
Oh, sure.
Recording.